Imagine never having to worry about crippling pain and exhaustion due to gout ever again. What if you could use a few simple lifestyle changes to take control of your health? In this video, I'm going to show you exactly how. Hello everybody, my name is Dr. Mao and I'm a triple board certified physician in New York City, and it's no secret that gout can be super painful and a super difficult condition to treat. But the good news is that gout doesn't have to be a life sentence. There are actually things that you can do today to get yourself on the path towards overcoming this debilitating condition. And you don't need a magic pill or surgery. I mean, sometimes you do need medication, but what you need the most is commitment, consistency, and knowledge, which I'm here to give you in this video. Vámonos!
3, 2, 1.
Dr. Mauricio Gonzalez is a Mexican physician based in New York City.
First, what is gout? Gout is a type of arthritis that occurs when excess uric acid builds up in the body and forms into crystals, which then get deposited in joints, tendons, etc. Symptoms include severe pain, swelling around the affected area, and inflammation. It basically hurts like hell. Most common site is the big toe, but actually can happen in multiple joints. How do we diagnose it? If a doctor is suspicious that someone has gout, the doctor will do a joint fluid test, which means with a needle taking some liquid from the joint and look at it under a microscope and look for crystals made out of a substance called monosodium urate. Now, enough with the boring stuff. Let me give you 5 powerful tools to control and improve this condition. Number 1, avoid foods that trigger gout. This is simple, right? Most of these foods are high in purine. Purine is a chemical compound found in the cell structure of all living organisms. Dietary sources of purines include red meat, processed meat, organ meat, seafood, legumes, beans, spinach, and mushrooms. Why does this matter? Because high levels of purine in the diet can increase uric acid levels in the body, which may lead to gout and other conditions like kidney stones. But I always tell my patients that they have to check for themselves. Some patients do not have problems with lentils, lentejitas, but some patients do. As a rule of thumb, I do discourage red and processed meats as well as organ meats, and then we can see how we find the sweet spot for their diet. Number 2, avoid sugary drinks and alcohol. These are 2 of the major problems with gout. Studies have shown that consuming high amounts of sugary drinks, such as soda and fruit juice, can increase uric acid levels, and the risk of developing gout goes through the roof. One study found that in men, the daily consumption of a portion of a soft drink, that means 250 ml or 8 ounces, almost double the chance of high uric acid. Plus, these sugary drinks make your pancita grow. No es bueno. What about alcohol? Alcohol can increase uric acid production in the body, leading to elevated levels of uric acid in the blood. Secondly, no one knows this, but alcohol can actually impair the kidney's ability to excrete uric acid, leading to a buildup of uric acid in the body as well. Several studies have shown that alcohol consumption, particularly beer and liquor, is associated with an increased risk of developing gout. Now, it's worth noting that not all individuals who consume alcohol will develop gout. There are other factors such as genetics, diet, and lifestyle, which also play a role in the development of this condition. But reducing the amount of alcohol you drink will always be a great thing to do. Now, before we move on, if you're enjoying my content and want to stay up to date with all my latest videos, please subscribe to my channel right now. Your support means the world to me, so thank you in advance for subscribing. Number 3, eat the right diet. Believe me, it's amazing what you can achieve with a good diet. Let me give you an example. The DASH diet emphasizes consumption of fruits, vegetables, whole grains, lean protein sources, and low-fat dairy products, while limited intake of saturated fat, red meat, processed foods, and added sugars. This dietary pattern has been shown in multiple studies to be very effective in reducing blood pressure and improving overall health. But what about uric acid? One study found that individuals who followed the DASH diet had significantly lower uric acid levels compared to those who did not follow the diet. Furthermore, the DASH diet has been found to be more effective in reducing uric acid levels compared to a low purine diet, which is a traditional way to approach gout. Frutas y verduras, como decía la abuelita. Number 4, exercise, my friend. Exercise can help to reduce uric acid levels by promoting the excretion of uric acid through the kidneys and increasing insulin sensitivity, which can lead to improved glucose regulation and reduce levels of uric acid. So basically, exercise makes you pee more uric acid and also helps you to regulate your glucose levels. However, it's important to know that high-intensity exercise or sudden increases in exercise can lead to temporary elevations in uric acid levels due to the breakdown of muscle tissue. This is typically not a cause for concern, and levels will typically return to normal within a few hours. And overall, exercising can help you maintain a healthy weight that is related to less chances of getting gout. Win-win. Plus, you're gonna look amazing. Number 5, take medications as prescribed, please. There are some individuals who prefer supplements over medications due to concerns about potential side effects. However, it's important to know that not all supplements may be effective enough in reducing uric acid levels. Vitamin C might help, but the effect is minimal. Making the lifestyle changes I suggest in this video can result in a 10 to 18% decrease in uric acid levels, which is life-changing for some folks. So basically, for some people, taking medication alongside these lifestyle changes can lead to optimal results. Your health is all you have, amigos. Hope you like this video and unlock a world of amazing content and be the first to know about exciting updates by subscribing to my YouTube channel right now. Don't miss out on all the fun. Dr. Mao explains.
3, 2, 1.
Dr. Mauricio Gonzalez is a Mexican physician based in New York City.